Welcome to Module 4. We're going to be talking about a skill that is absolutely central to your role as a CNA, measuring blood pressure. Now, this is a fundamental part of patient care, but believe it or not, it's also surprisingly easy to get wrong. And our goal here is simple, to make sure you get it right every single time. Because honestly, patient safety really depends on it. Okay, let's just let that sink in for a second. This statement really gets right to the heart of the matter. See, an inaccurate reading isn't just some tiny error on a chart. It can literally lead to a misdiagnosis or the wrong treatment plan. That's why we're not just going to go over the steps. We are going to master the technique and really understand what those numbers are trying to tell us. So before we jump into how to measure it, let's make sure we're all on the same page about what it is. At its very core, blood pressure is just a measurement of force. Just picture it. With every single pump of the heart, blood is pushing out against the inside walls of those arteries. That force is what we're measuring. Now, every single reading you take gives you two key numbers, and together they tell a little story. You've got the top number, the systolic pressure. That's the highest point of pressure right when the heart contracts and pushes blood out. Then you've got the bottom number, diastolic. That's the pressure when the heart is at rest, filling up between beats. It gives us this perfect little snapshot of the heart's whole work and rest cycle. Okay, so why all the fuss about these two little numbers? I mean, really, why do they matter so much? They can seem pretty abstract, right? But the truth is, they're a direct window into the health of a patient's entire circulatory system. Well, it all comes down to something called organ perfusion, which is just a way of saying how well blood, with all its oxygen and nutrients, is getting to the vital organs, like the brain and the kidneys. If the pressure is too high for too long, it puts a huge strain on the heart and arteries. But if it's too low, it can mean those organs aren't getting what they need right now. All right, we've got the what and the why down. So let's get to the really important part, the how. This is where you as a CNA play such a critical role. Let's break down the essential steps to get a perfect measurement every single time. Now listen up, because before you even think about inflating that cuff, these three things are absolutely non-negotiable. You have to have the right cuff size for your patient's arm, the arm has to be supported at about a heart level, and your patient needs to be resting quietly. Get these three things right, and you are well on your way to an accurate reading. And here is a perfect look at what that correct placement should be. First thing you'll notice, the cuff is on the bare arm, never over clothing. It should be snug, not too tight, and positioned about 1 inch above the bend of the elbow. And see that little arrow? That needs to be lined up right over the brachial artery. It's all about that precise placement. You know, knowing what to do is half the battle. The other half? Knowing what not to do. So let's take a look at some of the most common mistakes that can seriously throw off your readings. And what's so important to understand here is that these mistakes aren't just random. Nope, they cause predictable false readings. For example, if that cuff is too small or their arm is hanging down below their heart, you're going to get a false high reading. On the flip side, a cuff that's too loose can give you a false low reading. Knowing this helps you troubleshoot and get it right. Okay, so you followed all the steps, you've avoided the common mistakes, and now you have your reading. So what do those numbers actually mean? Let's figure it out. Think of this chart as your go-to guide. For adults, a normal reading is less than 120/80. From there, you can see how the numbers climb up through the different stages of hypertension. But I really want you to pay attention to that last row, a hypertensive crisis. If you see numbers that high, that's a medical emergency, and it requires immediate attention. It's really important to think of high and low blood pressure as telling two totally different stories. High blood pressure, or hypertension, is kind of like a slow burn. It's often a long-term risk factor that can lead to serious problems down the road. But hypotension, or low blood pressure, that's often an alarm bell going off right now, signaling an immediate problem like shock or dehydration. So this is where the rubber meets the road. You get an abnormal reading, what do you do? What is your responsibility as a CNA in that moment? So if a number looks off to you, your first instinct shouldn't be to just write it down and move on. Your first instinct should be to recheck it. Go back through your steps, make sure you use the right cuff, position the patient correctly, maybe even lay them down flat if their pressure seems low. And then, no matter what, you report all abnormal findings to the nurse. All right, and then there are the red flags. These are the situations that mean you stop what you're doing and get the nurse immediately. A systolic below 90 or above 180 is a huge one. So is a sudden, big drop from what's normal for that patient. And if they have any symptoms at all, like dizziness, confusion, or weakness, that is not a wait and see moment. That's an act now moment. So let's wrap up with this final thought. Measuring blood pressure is not just another task you check off a list. It is a massive responsibility. Your accuracy, your diligence, it can quite literally make all the difference in a patient's outcome. So please remember, when in doubt, recheck and report. You could be saving a life.